Hello again, Peter, it's Richard. I'm just here to do your flush and your medication of your line, if that's all right. Are you ready for me to do that? Excellent. Okay, I'm all washed and prepared for doing this. I've got my apron, I've got my gloves on, I've given my hands a good wash. So before we do anything else, I just want to make sure you're comfortable. I want to make sure you're not feeling unwell in any way, you're not hot, that you've not got any pain in your tummy, or you've got any bloated feeling in your tummy. Just going to check around the site as well, make sure that there's no redness or pus or anything forming around that site. It looks really good at the moment, so nothing to worry about there. And you feel all right? Excellent. Okay, so what we're going to do to start with, now you're in a nice comfortable position, I'm just going to take this is just ordinary water, I'm just going to give it a flush through this line here, just to make sure it's all flowing freely before we put the meds in. Got all the medications are ready. I'm ready to give you without any problem. So I'm just going to disconnect that, and you can all see. Okay, so I'm connected in with my 20 mils. In this case, you might use the larger one. 20 mils of water, and we're just going to push that into the line. Just checking for any changes in Peter here. No problem at all, it's going in quite smoothly. No problem at all. So I'm going to clamp off again there, just whilst we swap over. I'm going to put that down there. Here's my medication, foul looking stuff it is. So Peter, the medication's going in now. Okay, so that just goes in slowly. There you go. This is just your vitamins for today. Just to help you keep well. In they go. Any problems there, Peter? No. Okay, good. Okay, once all that's gone in nice and smoothly, put my clamp on again whilst I swap over. Here's some water I would have prepared earlier, but I'm a bit short of syringes. So I'm connecting my flush water up again, and I'm just going to undo the clamp, and I'm going to push the water in. Now what you'll notice, you can see this, it's still brown in the tube. I'm going to try a different sort of technique as I go. Okay, I'm going to do push, pause, push, pause, push, pause, push, pause, push, pause, push, pause. Now it doesn't seem to have cleared it in this case, so what I'm going to do, I'm going to flush it with a little bit more water. Okay, so again, you can draw from your water as much as is needed to make sure that the tube is clear. And again, as we do this, you should see that brown stuff, residue of the medication, you should see that gradually disappearing. And we push, pause, push, pause, push, pause, and then we just clamp, disconnect, put the cover back on, make sure that's nice and firm, and then release the clamp in this case again. So this line is completely locked with water. You can then put that back to wherever's comfortable for Peter, and we can just say to him that went well, and explain that all the medication's gone in, and just to keep us informed if he has any changes, if he starts to feel unwell or anything like that.